Today's topic is PCOD or PCOS. First, let's talk about what are ovaries and what is their normal function. So see these almond shaped structures. So there will be two ovaries in everyone who's born a female. Okay, so these are the ovaries, these are the fallopian tubes, then you have your uterus, cervix and vagina. So each of these ovaries has lot of immature eggs right from the time we are born. Okay, so see, this is an ovary. When we reach puberty, after that, under the influence of hormones, every month or every menstrual cycle, one of these many follicles, one of the follicles gets matured and causes ovulation, and there is a chance for pregnancy. And when we do not get pregnant that month, then the egg dies and everything is secreted along with the uterine lining, which we call as menstruation. So the ovary has two main functions: the production and maturation of eggs and secretion of hormones. Every one of us is born with so many follicles or immature eggs in each of our ovaries. With time, every year this number keeps on decreasing, and in our complete reproductive age, that is around 15 years to 45 to 50 years, around 400 to 450 follicles get matured one by one every month, and they are released for ovulation. This happens till the complete cessation of menstruation or when our menstruation stops. Now, what is PCOS? So PCOS is polycystic ovarian syndrome. So this happens when there is some hormonal imbalance. If someone is said to have PCOS, they will have at least two of these three conditions. The ovulation may be absent, that the egg is not getting released in them every month, okay, which will lead to irregular periods or no periods at all. They will have high levels of androgens or male hormones, which can cause excess of body hair or facial hair. Like they can have cysts, that is the immature eggs. The mature and immature eggs may be filled with fluid. So polycystic means having many cysts. So the ovary will be filled with these cysts. And many of the women do not even know that they have PCOS until they have problem with getting pregnant. PCOS can also cause unwanted hair growth, dark patches of skin, acne, weight gain. And PCOS, you would have heard some people say I have PCOD, others say I have PCOS. What is the difference? So see, PCOD is just a condition, polycystic ovarian disease, but this is polycystic ovarian syndrome, means this is a bigger thing. This is something so if your ovaries have cysts, then you have PCOD. So you can have irregular periods, but this condition PCOD can be treated just with lifestyle change. Like if you start eating healthy diet and do regular physical activity or exercise, you can treat your PCOD based on lifestyle changes. PCOS, on the other hand, is something more serious. It is an endocrine disorder, means can have serious complications. Then someone who has PCOS is at high risk for many of the diseases and can even lead to heart disease. So see, for comparison, PCOD is just a stone, but PCOS is like a mountain. Now, with PCOS, people can have excess body hair. There can be insulin hormone resistance, which is a risk for diabetes. Then there is anxiety, infertility, there is depression, acne. Okay, see how the symptoms are. So most of them have irregular periods, androgen, that is male hormone excess, which will lead to facial hair development and other things. Excess body facial hair, absence of period. 30 to 40% of people who have PCOS will have absent periods, but 30% will have regular periods also. So just on basis of your periods are regular or irregular, you may not know that you have PCOS or not. Other symptoms can be the ovarian cysts can be present, there can be hair loss, and there can be weight gain. The wall of the uterus may become thick. There can be multiple cysts which can cause pelvic pain. Women with PCOS are also at high risk for obstructive sleep apnea. In sleep, we have breathing problem during sleep. Okay, then we have insulin resistance, which can lead to diabetes. Then we have metabolic syndrome, means there can be lot of risk factors for many metabolic disease like heart disease and diabetes. So after diabetes we can have obesity, we can have heart disease and high blood pressure, mood disorders, and endometrial, that is in the uterus, the wall of the uterus may become can develop into cancer also. Now, how do you diagnose PCOD? So, a doctor will ask your history about your menstrual history, whether you are having regular or irregular periods, and from how much time you are. In ultrasound, if you have polycystic ovary, this is how the ovary will look like. See, these are multiple cysts. Multiple cysts are there. They are filled with fluid. Okay. So the ovary is very enlarged here because of so many cysts. Now, suppose it is not PCOD. If it is not PCOD, it can be other hormonal abnormalities. These need to be found out by your doctor. What is the treatment and what is the solution for PCOS? So first and foremost, which is in your hand, this is in your hand, your lifestyle change. You can start eating healthy diet. Eat more of fruits and vegetables and less of packed food and pizza, burger, soft drinks, carbonated drinks. Eat healthy diet, eat the natural diet. Lose weight. Losing weight can avoid so many health problems that you can't even count. And exercise. And then if your doctor feels like, they can give you, based on your complaints, your doctor may prescribe you different medications to help you ovulate, or for your hair growth, or to regulate your menstrual cycles. So to summarize, PCOD occurs due to hormone imbalance. You can have irregular periods, excess body hair, weight, and to prevent it, you can have a healthy lifestyle, diet, and exercise.